did some practical implementation of CNN for image classification. Now, today's talk will be more of related to the practical applications of deep learning, or specifically AI, in the domain of healthcare. So, firstly, we will discuss uh, some case studies of AI in healthcare, specifically deep learning in healthcare. We'll see how we can implement or solve different problems of healthcare using deep learning or CNN or object detection. And then in the next second lecture, we will be discussing the advanced version of AI, that is generative AI. I'll briefly introduce what is generative AI and how generative AI is transforming healthcare in recent times. So, coming to the agenda of this two lectures. Firstly, the case studies of deep learning in healthcare. So I'll just briefly introduce, just recap of what we have discussed till now. Then I'll introduce some of the major use cases of healthcare using deep learning. Then in the next lecture, we will be more concerned about the generative AI applications in healthcare. Uh, LLM based applications, or generative adversarial network based applications, diffusion model based applications. And then in the last, I'll briefly talk about what all uh, projects we are doing at MNIT, specifically in the domain of healthcare, and how we are utilizing artificial intelligence to solve different healthcare problems, and how we are building some solutions which can be used by common public. Uh, Before diving more into it, I just want to add a disclaimer here. Frankly speaking, I'm not a doctor who can cure disease. I'm just an engineer, and whatever little knowledge I have related to medical field, uh, that has been acquired through different research papers. And but if I make any mistakes specifically from the medical domain, so please forgive me for that. And I'll be more uh, concerned about the engineering side of biomedical engineering or the healthcare. And since it's my expertise specifically as a engineer. Now, I'm sure nowadays most of you must have uh, most of you must be using ChatGPT these days, and you must have used ChatGPTs for different type of applications, whether it is writing an email, or generating certain questions, finding answers from for some questions, uh, making a customized tour, or there are n number of applications or n number of queries which people ask on ChatGPT or any related tools of generative AI. And I'm sure some of you must have, I have read in newspapers that people ask medical related queries to the generative AI tools, and some of the responses were not as prescribed, and there were after effects of those wrong responses. So, but I'm sure the responses you must have gathered, you must have asked certain questions to ChatGPT or generative AI based any tool. And so I just one day I just tried this, that I have 101 fever and symptoms of cough and cold, and let's see what ChatGPT tells us. So the results were very surprising. You can see uh, that ChatGPT has given certain diagnosis, it has given some remedies, it has also mentioned certain uh, over-the-counter medications to take care of the fever and this kind of medical condition. So the point here which I want to make is the usage of AI has tremendous, specifically in the field of healthcare. You can see, uh, in the same manner, we ask the doctor different queries related to your medical condition. In the similar fashion, the generative AI based tools, and they are giving you results the same way the doctor used to. But of course, the uh, efficiency, of course, the correctness, that is still questionable. And I'm sure the day is not far when these tools will be capable enough to have human uh, kind of reasoning, doctor kind of reasoning, and they can provide this kind of diagnosis. So that's the power of AI, which we are seeing these days. With this backdrop, I would like to start with basics how we implement AI based models for solving different healthcare problems. So, starting from the basic, I think every one of you must have gone through these terms: artificial intelligence, machine learning, deep learning. We also had a detailed session of deep learning in previous days. The terms are interchangeably used, but they have clear boundaries. Just for a quick recap for all of you, uh, artificial intelligence, the term was coined almost 6 to 7 decades earlier. Any technique that enables computers to mimic human behavior, transferring the human intelligence to your computing devices. Machine learning, and so learning, training the machine, giving the machine the ability to learn without explicitly being programmed. Third, a sub branch of machine learning, which has brought revolution in our human life, whether any field of your life, deep learning has a greater impact in every aspect of your life. So deep learning, as I told you earlier, it is mainly responsible for extracting patterns from the data itself, which was limitation of machine learning earlier. I told you where machine learning was more about extracting features, computing handcrafted features, and then training a suitable model. In comparison with that, deep learning, we don't have handcrafted features. We can straight away use these models for learning the features, or we also call it representation learning. And the deep learning model, the background of this deep learning model is inspired from our human brain. This, the way our human brain perceives things, the way our human brain trains by seeing different kind of examples. In the similar fashion, the deep neural networks also gets trained from large volume of data. Now there is another term which is popular in last 2 3 years, and which has further enhanced the reach of AI in our common life. That is generative AI. So uh, it's basically a type of artificial intelligence. And why the name generative AI? It is because it can produce content. So generative AI, typically it's a type of artificial intelligence technology, and which is capable of producing various type of content or data, uh, that includes text, that includes image, audio, or synthetic data. So uh, with the help of generative AI, we can have large volume of applications in different domains, different application domains. Now, just a quick recap: machine learning, two types of can be majorly categorized into two types. One is unsupervised ML models or supervised ML models, and so basically, machine learning, we can say that it's a program or a system that trains a model from the input data, and the trained model uh, can make very useful predictions from any unseen data which was not provided during the training process. So basically, the data drawn from same one used for train the model. So new data means it was not used during the training process. Majorly two types, unsupervised and supervised machine ML models. And the name itself tells you. One is the supervised, where supervision is provided during the training process. That means, along with the training examples, you are also provided with the labels of the data. However, in the case of unsupervised, there is no supervision. That means no uh, no label data is provided during the training process. Now, let me take an example. Suppose, let's say you own a clinic, because since we are discussing about smart healthcare, let me take an example of example related to healthcare. I hope I am audible. If you have any issues, please let me know. Write in the chat box. I hope I am clearly audible. Please write in the chat box if I am not audible. Okay, fine. I got a go ahead from one of the participants that yes, I'm audible. Let us continue where we left. Suppose you own a clinic and you have a historical data uh, comparing the text and the email reminders to the patient, and which also includes the number of days before an appointment the reminder was sent. And then, as a result, you do have corresponding missed appointment rates. So you have emails sent to the patients for reminder of the appointment. You have text messages for sent for reminder, and then as corresponding missed appointment rate is also available to you. So now, in this particular example, we want to develop a model which can predict the likelihood of the future missed appointment based on the timing and type of past reminders, whether it was sent through email, whether it was sent through text, and how many days before the appointment the the reminder was sent. So, given these three features, I would rather say these are the features: uh, type of reminder sent, how many days earlier to the appointment date the email or text was sent, and then on the y-axis, correspondingly, we have percentage rate of missed appointment. Right. So, with the help of this supervised machine learning, we can use these features, train a model, and based on these features, this model can learn what will be the percentage of uh, m- percentage chances of missing the appointment. Right? It might be an inference that if you use emails for reminder, that means there is less likely chance of missing the appointment, or maybe vice versa. But this model can give you an inference that with the given data, with the given type of reminder sent, and how many days prior to the appointment date we have sent a reminder. So in that case, the model can tell you whether it will be a missed appointment or it will be attended appointment. Similarly, let's say, let me give you an example of unsupervised machine learning, and specifically from medical domain perspective. Suppose, yeah, firstly, what is unsupervised machine learning? Just to give you a brief overview. So, unsupervised machine learning, it these type of models can aid with the discovery, and they basically identify the hidden pattern from the data. Since it's unsupervised, we are not providing any labels during the training process. Rather, these models themselves club the data together based on similarity. There could be different factors or features related to the similarity of the data. Here you can see there are majorly two types of data: the red dots and the blue dots. Now, let me give you an example here. Suppose you want to develop an unsupervised machine learning model, and which has to analyze blood glucose and cholesterol levels. And this model should group the patients with similar health profiles in terms of total cholesterol level and the fasting glucose level. So basically, you can see here, it has the model has is able to group the people with two types of profile, in which the red dots signifies higher fasting glucose level, or medium to high uh, fasting glucose level, and low cholesterol level. However, the blue dots corresponds to high, medium to high cholesterol levels, but the fasting glucose level is scattered all over the scale. So it is able to draw a boundary between these two types of groups. So unsupervised machine learning, no label is provided, but they are able to group similar profiles here. So one of the typical example of unsupervised machine learning is clustering. Simple unsupervised machine learning: access data, y is label, learn a function to map this input data to the label y. And typical examples are classification, regression, object detection, semantic segmentation, and so on. However, in the case of unsupervised machine learning, we don't have label. And the goal of unsupervised machine learning is to learn some kind of hidden pattern, or uh, hidden similarity in the underlying structure of the data. Most commonly used unsupervised machine learning model is clustering, and K-mean clustering is one of the popular clustering technique. Dimensionality reduction or feature reduction is another type of unsupervised machine learning model. This is another depiction of this one. Now, deep learning, I think we have already talked about deep learning in uh, detail, and we also talked about feed-forward neural network, how feed-forward neural network processes the information, how these artificial neural network are inspired by the human brain. And uh, with the help of deep neural networks, we can develop models uh, which have human kind of reasoning. They can also perceive uh, the data in the similar manner the human perceives the data. This was a convolutional neural network, which is combination of convolution layer and pooling layer. And in the last, we do have flat and fully connected, and then softmax for classification of. So basically, softmax assigns probability to each of the class, and whichever class has the highest probability, that particular data or the input is classified to that class. I think we have already talked about. And one more thing which I could have missed is, since I told you deep learning is about representation learning, so these layers are responsible for extraction of features. However, the later layers, like the flattened, dense, fully connected layers, are responsible for classification. Now, coming to the historical perspective of AI, and how AI entered, AI based solutions were started gaining popularity, how the story started. So, the first a case study, I would rather say, the first case study of start of computer aided radiology, we is from 1975, where Professor Lodvik developed a research plan and he wanted to apply. He wanted to develop certain software program for the diagnosis of the radiology images. So a research plan was developed. He wanted to interface the radiology instrument and read the radiology images and interpret them with the help of computer programs. So that was the one of the earliest examples of applying computer aided diagnosis specifically in the field of radiology. Later on, Professor Lodwick received a Nobel Prize nomination. Unfortunately, uh, he didn't receive that Nobel Prize, but he received a Nobel Prize nomination for his groundbreaking work in image modeling and computer diagnosis of bone tumors. So that's a typical example of computer aided radiology, and that was the almost the start of implementation of automatic diagnosis of radiology images with the help of computer programs. Later on, these computer programs were more and more moved towards the artificial intelligence based applications or programs. Now, coming to different applications, AI based applications in the healthcare, uh, the reach of AI is in almost every aspects of healthcare, whether it is diagnosis, whether it is analysis of uh, diagnosis images, X-ray images, CT images, mammography, MRI, and diagnosis tests, microscopic tests, developing treatment options, or studying the genetic information, drug discovery. There are large number of applications of healthcare, applications of AI specifically in the domain of healthcare. Let me pick some more of them, and then we will see how we can implement these models to solve these problems. Like one of the typical example or typical application example of deep learning or AI is discovery of new antibiotics. So uh, discovery of new antibiotic is very complex domain, and this has happened that every most of the times we result into the same discovery of the same antibiotic. So with the help of deep learning, scientists have developed certain models which can suggest new antibiotic and which are turning to be a game changer specifically in the pharma domain. Coming to the radiology images based diagnosis, google uh, google has developed certain models which can detect breast cancer from the mammograms, and we all have seen the very unfortunate time for mankind, COVID-19, and that has resulted into many unnatural deaths. That at that time, there were basically the doctors or the engineers, the biomedical scientists were able to detect or find the signs of COVID-19 in the chest X-ray images. Uh, this particular diagnosis was very handy, specifically as an alternate for RT-PCR based tests, and the only problem at that time was the availability of positive samples. So that took some time, but afterwards, I mean, uh, the scientists were able to develop a comprehensive data set of COVID-19 chest X-rays, and they were able to develop models which can detect signs or symptoms of COVID-19 in the chest X-rays. And it was very helpful and handy at a later part of that COVID wave, and it was developed as an alternate way of diagnosis, diagnosing COVID-19. One of the typical application of deep learning in uh, identifying the eye diseases is diabetic retinopathy, detection of diabetic retinopathy. uh, Diabetic retinopathy is very common in the diabetic patients, and the doctors advise the diabetic patients to regularly go for eye checkup. And diabetic retinopathy is detected using your fundus images, which is your image of your fundus, and with the help of deep learning models, abnormality related to the diabetic retinopathy can be detected. So these were some few of the use cases of AI or deep learning in medical domain. There are n number of applications which has been implemented and which has been solved by different scientists. Some of them, let's talk more about them, like specifically in the field of diagnostic and images. Google's DeepMind, now it has become Google Health. They have developed models like AlphaFold, and they are capable of predicting the protein structures, which can further aid for drug discovery. I talked about discovering the new antibiotics. So basically, these models developed by Google, they are capable of drug discovery, and further they can help in disease research. Additionally, one of the solution from Google Health is related to detection of eye diseases, and specifically the abnormal condition related to diabetic retinopathy or macular degeneration from the retinal scans or the retinal scans or the fundus images. Another one of the startup. This startup is from India, and Cure.ai, which has developed a platform, which has developed a system, AI-based system, which can analyze chest X-ray images or head CT scans, and they can detect conditions like TB, brain hemorrhage, and often in underdeveloped region where radiologists are scarce. So the aim of Cure AI is to make healthcare accessible even in the remotest of the areas. Then there are a lot of big companies which are investing heavily in the development of AI-based healthcare solutions. IBM's Watson solution, it is for oncology, and this particular solution helps the oncologist by analyzing the patient data. They can provide personalized recommendations based on the previous medical literature or the patient history. Uh, Others to discuss, like Trust Stroke from University of Heidelberg, they have developed a AI-powered decision support system that personalizes stroke treatment by analyzing different clinical and imaging data of the patients. Nowadays, these chatbots are very popular. An AI-based chatbots, and the patients can ask questions to the chatbot. One of the example I gave you uh, on the first slide of this presentation related to chat GPT based diagnosis. Similarly, more specific and more accurate AI chatbots are being developed. They are being installed in different hospitals. Like one of them is Babylon Health. This basically offers an AI-powered chatbot, and uh, this is capable of providing medical advice, and it can help patients to determine whether they need to see the doctor. So basically, the initial screening can be done with the help of these chatbots, and the patients can give right their symptoms. They can ask very basic queries. Also, these chatbots or virtual assistants can be handy in hospital management. They can be helpful in appointment arrangement. So uh, there is a lot of use cases specifically from chatbot perspective. Another chatbot which is popular is Lola, that is uh, a chatbot which is specifically for assisting the heart failure or COPD patients by guiding them on medication adherence and follow-up care. You all must have seen or heard about uh, implementation of robotic surgery in different modern hospitals. So that has become reality these days. Even in India, even in Jaipur, there are a lot of hospitals. They are offering robotic surgery, and these are some of the examples like Da Vinci surgical system. It is AI powered robotic surgery solutions, and they claim that it is highly precise and specifically designed for minimally invasive surgeries. Another one is Medtronic GI Genius. It's again AI powered endoscopy system, and it can detect the colon polyps during colonoscopies, and it reduces the missed diagnosis of this specific type of cancer. Uh, Other use cases like personalized treatment plans, diet plans, these are another examples or use cases of AI in the healthcare. We will discuss more about it when we will be discussing generative AI in healthcare. Now, how this magic happens, how these models are able to see what the doctors see, or how these models are able to diagnose what the doctor can diagnose. So let us quickly have a discussion on this one. Like, let's take the very popular example for COVID-19 detection. So how it happens? So these models, there are models which are basically trained on large volume of data. We provide chest X-ray images to these models, and these models can find out the class of this chest X-ray, whether this chest X-ray is of normal category, or it's TB or pneumonia, or it is have symptoms of COVID-19. Diabetic retinopathy, I told you, I gave you an example here. We can provide retinal fundus images, your image of your retina, and uh, these images can be provided to the model, and this model can basically identify whether this fundus image is normal or it's a damaged one. So I told you the severity of diabetic retinopathy, and sometimes due to this particular disease, it can lead to vision loss as well. Basically, this particular disease damages the blood vessels of retina. One of the very complex medical modality is MRI, and one of the complex uh, organ of your body is brain. And with the help of MRI of the brain, uh, there are different diseases which are being diagnosed. And the segmentation, basically brain contains different type of fluids, and based on the volume of these fluids, the diagnosis is being done. So basically the segmentation of these MRI images can be very handy if we can develop a deep learning based model for segmentation of these MRIs. This can add value to the diagnosis. So these are some of the examples where we can see that brain MRI segmentation is being done using deep learning based model. I have referred one of the paper of 2016 in which deep learning based model was proposed for MRI segmentation. So segmentation of MRI specifically for brain images can be very handy, can be very helpful. Coming to the cancer detection, and if we talk about breast cancer detection, so we have histopathology images. These are nothing but very high resolution microscopic images of your blood cells, and by seeing these histopathology images, the model can detect whether these are benign or these are malignant one. Now, how these models are being developed, how these models help in detection. And so, as I was telling you, these deep learning based models are inspired from the human brain. They work in the similar fashion uh, the human brain works. So, whenever a new radiologist is being trained or any radiology expert is being trained, uh, we basically provide during the training process, they are being shown various types of X-ray images. They are given with large number of examples of COVID-19 category or the normal category. And then once a large number of images, X-ray images are being shown to the under training radiologist, if a new unseen image is being shown to the radiologist, he or she will be able to identify whether it is normal or it is COVID-19 type of X-ray. In the similar fashion, the deep learning based models are being trained. As I was telling you, in supervised machine learning, we provide the label along with your uh, that data. So during the training of these deep learning models, what we can do, we can provide label of these X-ray images, like whether it is COVID-19 or normal, and we can provide these to the models. And during the training process, basically these models will learn from the data. And if after completion of the training, if unseen image is being shown to these models, they will be able to identify what type of these images are. So how do we build these models? And so I was telling you, we provide thousands or lakhs of chest X-ray images along with the label. And with that help, these models or algorithms are being developed. I already talked about how we train these models. We talked about gradient descent algorithm in the previous lecture. We talked about back propagation algorithm, and where we were minimizing the loss function. Sorry, where we were minimizing the objective or the loss function with the help of back propagation algorithm. So that is how these models are being trained. There are some of the popular CNN architectures which are extensively being used in classification based tasks in the healthcare. This is how a CNN can help us in detecting the class of this brain MRI images. We can apply different filters on this image in as a part of convolution layer. I'm sorry, the convolution layer further computes the feature map. They are being passed through the pooling layer, which is responsible for reduction of the dimension. Then another convolution layer and pooling layer. Finally, as for classification, we have to bring these feature maps as in the vectorized form, which is and pass through the fully connected layers. And finally, the last layer is some kind of activation layer like softmax, and softmax basically assigns the probability for each of the class. Whichever class has the highest probability, it is being classified to that particular class. Now there are certain challenges whenever we implement these kind of models, specifically whenever we build or train these kind of models. One of the major challenges, specifically in the field of healthcare, is the data set size challenge. And as I was giving you an example of detection of COVID-19 using uh, chest X-ray images, developing a model on chest X-ray images for COVID-19 detection. And in the earlier times, I mean, on the initial days, there was a very less availability of chest X-rays of positive cases. So specifically in healthcare settings, we do have scarcity of data due to various reasons and due to various privacy and ethical issues as well. So there are certain solutions for solving this data set size challenge, though it is not very efficient if we have very less number of positive examples. But these solutions are very handy if you have to increase the or solve the data set size limitation. The idea is transfer learning. The term itself tells you that we can transfer the learning from one domain to another domain, or we can fine tune any convolutional neural network if it is a classification task. The idea is we can train a convolution neural network on the images of a particular domain where we have abundance of data. Suppose we can train a convolutional neural network for classification of cats and dogs. There are large volume of images available with us. So this model can be trained with this data set. Then further it can be fine tuned to adapt to this particular domain, that is medical domain. And this fine tuned or fine trained convolutional neural network can be further used in the medical domain or detection of COVID-19 or normal X-ray. Why it will be effective? Because let me tell you, I was we discussed in the previous lecture that the initial layers of convolutional neural network are responsible for detection of low level features like edges and corners. And then as we move forward or move deeper into the convolutional neural network, the layers are responsible for extraction of high, medium level features and then further high level features. So now these low level features, like edges and corners, the methodology of detecting those low level features like edges and corners will be same, irrespective of type of images. Detection of edges in the cats and dogs images is similar to detection of edges in the X-ray images or MRI images. So that's why what do? We train firstly train the convolutional neural network on the data set which has large volume of images, and then further we fine tune only the later layers which are responsible for high level features or domain specific features, and then train those layers, freeze the earlier layers and train the later layers to extract information from this specific domain. So that is how we try to solve the dataset size challenge using transfer learning. Another simple operations which are being directly provided by different AI tools for during the training of these models, like zooming the image or flipping or translating the image or combination of uh, different operations. So we call it as data augmentation. Now, whenever we are developing a solution for any healthcare problem, the first step uh, we have to take is collection of data set. And I was telling you that this is one of the most typical part to develop a suitable data set, to develop a data set which has enough number of positive as well as negative examples. So coming to this dataset development, we majorly have three parts of this dataset. The training dataset that is being used to train the data, and then as I was telling you, during the training itself, uh, we have to validate the training whether it is perfect or not, and then the testing dataset, which is unseen dataset, and that can be the unseen dataset that is being used to evaluate the performance of the developed model. Now, the problem with these dataset, I mean, specifically testing the models, is related to there are multiple challenges whenever we are going to test these models or develop the dataset. The one major problem is patient data overlap, and another one is During the collection of the data set, since most of the cases we are developing supervised machine learning based models, supervised kind of models. So we need to have the labels of these data sets. We call it annotation. So these are the challenges whenever uh, we are developing the model or we are testing the model. The problem of patient data overlap is, uh, suppose, let me give you an example. A patient goes for chest x-ray imaging, and suppose that patient is wearing a necklace, and that necklace is not being removed during the capturing of the x-ray. And suppose we put this x-ray into one class of the model, suppose positive or maybe negative, and then we train the model. So suppose we have put this chest x-ray into the positive examples, or let's say we are developing a model of COVID-19 and normal classification of COVID-19 and normal patients, and suppose this particular x-ray with the necklace we put into COVID-19 category. Now after 6 months, let's say the same patient goes, and this time the patient doesn't have symptoms of COVID-19. However, the patient is wearing that same necklace. Now, if we test the model on this new data set, which was taken up, the new chest X-ray image, which was taken after 6 months, this model might get confused. It might classify this new X-ray as COVID-19 category, though it belongs to uh, normal category because of this necklace. So the idea is, the point which I want to make here is, there should not be a patient data overlap. That means we should put the data from a particular patient in either one of the data set type. Either we can put them in training, or we can put them in testing or validation data set. There should not be any overlap. We should not put one, as the example which I have given you, the first X-ray we put in training, and this one was put in the testing one. So that's not the right way of developing the data set. We should have, we should ensure that there's no overlap of data among these data sets. Now, how do we ensure that? So we can have, uh, along with the image ID, whenever we are collecting the data, along with the image ID, we can also have patient ID associated with it. So ultimately, we should ensure that there is no overlap of patients in different sets. So ensure to have data from same patients in one set, either in test or validation or training. That will solve this particular problem. Now, coming to another challenge with testing and developing of the model is related to the ground truth annotation. So the problem of this ground truth annotation is very challenging, and there might be a scenario where we have difference of opinion among the difference of opinion among the medical practitioners itself. So what we can do is we can have consensus voting for deciding the correct label of these medical modality images. So, if majority of the medical practitioners are telling that this is the particular label of this image or modality, then we can classify or we can assign that particular label to it. Another way is, suppose we are, uh, let's say we are developing a data set for histopathology images, we can have, we can establish the label using another modalities. We can have another tests of that particular patient to detect whether that particular disease is there or not. Now, coming to the evaluation of the models, we have developed the model. We have learned about developing the data set. We have learned about how we develop the model and what are the challenges during the development of the model. Then we have learned how to test these models, and then finally we will talk about the evaluation of the model, how what are performance matrices we are going to use to evaluate the performance of these models. Suppose we are testing a model which takes histopathology images as input, and it categorizes or classifies it into two categories. The first one is malignant, and another one is benign. One is positive, another one is negative. Malignant is positive, benign is negative. The simplest uh, measure of performance is accuracy, and we define accuracy as probability of correct detection. Suppose you have developed two models, model 1 and model 2, and you can see here that given these 10 examples in test data, these are 10 examples, 5 of each category, and suppose the model 1 detects all of them as negative, that means benign. Still, the accuracy of the model is 50%. However, in the case of model 2, it detects some of them as positive, some of them as negative. Still, let's say the accuracy is 50%. So let me ask you a question, which particular model is better and why? For me, the model 2 is better because at least it is able to distinguish between the two classes. However, where the model 1 is only classifying them as negative examples, what happens if I take all of them as positive in the test set? That means the model 1 will basically uh, model 1 will basically uh, classify them as negative ones. All right, so at this stage, I would like to have a 5 minute break. Let's have a 5 minute break and then assemble back. It's As of now, it's 17:57. We will meet at 6 2, and then we will continue our discussion on this one. So please have a break and let's meet after 5 minutes.